We will have medical camps. We will have a medical camp at the Constitutional Square. We will have another medical camp at the Nakawa Market. And also in Intinda, we'll have another medical camp at the Intinda Market. So we believe that you, the media, you will mobilize members of the community to come and benefit from these services. In the market, Nakawa Market and the Constitutional Square. As I said, this is an opportunity to create awareness. Many people might think that HIV is no longer a problem. We are here to tell you that HIV is still with us. We have 1,490,000 people, Ugandans living with HIV. And each year, we get new HIV infections, 38,000. That is close to 1,000 people a week. And therefore, one cannot say that it is not a problem when we are still getting that number of new HIV infections. We get close to 20,000 AIDS-related deaths each year. Also to note that of the 38,000 new HIV infections, over a third, call it the majority, are our young people, adolescents aged 15 to 24 years. And again, if you look at that group of adolescents, the adolescent girl or the young women, people who are women less than 24 years, but they are already married, constitutes the biggest majority of new HIV infections. And therefore, Ugandans, we want to alert you that HIV is still a public health threat in Uganda. We, as government, together with partners, have done a lot. And indeed, compared to where we were 10 years ago, 15 years ago, we have done a tremendous job. We know that of the 1,490,000 Ugandans living with HIV, 92% have tested and they know their positive HIV status. So 8% of the people living with HIV are out there in the community, living without, when they don't know they are actually infected. And this is the group that actually, because if you don't know you are HIV positive, obviously it also means that you are not on treatment. And this is the group of people that actually continues to spread the disease. That's the reservoir where new HIV infections keep coming from. We have made progress on in putting people on treatment. 90% of our people have been started on treatment. And of those who have been started on treatment, 94% have attained viral suppression, which means that they are living healthy lives. They are not getting opportunistic infection. They are able to do their routine work. They are productive to their families. They can provide for their families, but they are also productive to government. They are able to do to engage into economic activities that they benefit them as individuals, but also benefit the government. So we are making progress. However, we still have challenges. I've already mentioned the challenge of new HIV infections manifesting especially amongst young people, but we have also the challenge of funding. You must have heard about the United States executive orders, which caused a lot of concern, not only amongst people living with HIV, but also amongst the service providers. And you, the media, there were lots of stories about it in the media, meaning that you too were concerned. And indeed, there was a reason for that concern, because the US government has been contributing over 55% of the funding for HIV services in Uganda. But I'm here to tell you that as we wait for the United States government to do their final review, because there was a 90-day stop, and tell us what next. Government and partners have not been seated. So following the executive orders, we have had a series of meetings. We have agreed with the partners to ensure that services are not disrupted. And so in the period of the 3 months that we've been through this period of uncertainty, all government health facilities and all faith-based health facilities and non-government hospitals have continued to offer HIV services. In addition, because previously we have had services offered using different approaches. There are HIV services that were being offered as a standalone in the what we call vertical clinic, HIV clinics. But we have also had services offered within the government and the faith-based organization health hospitals. But to mitigate the challenge that we face this period, the Ministry of Health issued a circular to all health facilities to integrate provision of HIV services amongst all the other health services that they offer in the hospitals and in the health centers across the country. And this has helped to ensure that services are continued. So I want to thank the Minister of Health for having quickly come out to provide this guidance to health facilities and all the other health providers. I want to also assure you that we've taken stock, and we are sure and we can assure you that we have enough stocks of drugs and health supplies for management of HIV services. And therefore, we have been able and will continue to be able to provide HIV services at least in the foreseeable future, which provides an opportunity therefore to government to also come in and take up some of the services that were over-reliant on the development partners. Related to this, Uganda AIDS Commission, again, together with UNAIDS and partners, since June last year, have been developing a national roadmap for sustainability of the HIV response. What this means is that stakeholders, all stakeholders, in-country stakeholders, government, NGOs, faith-based organizations, religious institutions, the cultural institutions, education, the security agencies, and all sectors of government take charge of in providing HIV services and integrate HIV services within the other programs so that it is no longer run in a vertical mode. We should realize that when HIV first broke out here, we did not have many options, but we had the people, including the media. And the media helped to spread the information that, look here, there is a problem. And that message that you spread, even when we didn't have the services, protected our people. People had to be careful, and many lives were saved. When the many options started coming up, HIV testing, technology, treatment technology, monitoring of the immune system technologies, partners came and they supported, but using an emergency mode. So the sustainability approach is to ensure that we move away from managing HIV as an emergency problem and integrate it. We know it still remains a social problem, but it is integrated in all sector interventions and managed as a social problem so that it is sustainable beyond the donor support that we have been receiving. So these executive orders have been an eye-opener, yes, but we had started the process, and it has helped us now to quickly finalize the roadmap that provides guidance to all the actors in the HIV area to ensure that we are offering services within our means. And this roadmap has been finalized. It will be presented to Cabinet, and once Cabinet assents to it, then it will be taken to all the government sectors and all organizations and entities that support government to make sure that services are offered in a holistic, using a holistic approach, using an integrated approach, but importantly, delivered with government in the lead and communities and sectors implementing government priorities. But I wanted to use this opportunity to assure the public that services have not been interrupted because of the uncertainty that we've been going through. Services still exist, services are still ongoing, and members of the public are encouraged to continue going to their nearest health facilities to access these services. Now, before I conclude, let me again emphasize that the media, you have been a strategic partner in the national HIV and AIDS response since the first case was discovered. And this is over 40 years ago. You've been fighting with us relentlessly. Although sometimes you sensationalize, but I think largely you have played a positive role in fighting against this epidemic. I want also to highlight the aspiration or the desire of His Excellency the President. His Excellency the President has consistently said that he feels there is complacency in the communication of messages for HIV prevention. And here we believe that you, the media, can support us to reinvigorate and re-energize the campaign that takes messages of HIV fight to the general public, and most especially to our young people who may not have known the epidemic in its true colors, what used to happen at the start. So the president called this reinvigoration or Enduru. Enduru, of course, is a Chinyankole word meaning alarm, that we must all work together to make sure that we create that alarm and make the public to realize that actually the enemy is still around, and we should not rest until we have routed him or her completely. Also, that government has made a commitment to the international community as part of fulfilling or attaining the Sustainable Development Goals by 2030. And in our case, His Excellency the President has signed to Presidential Fast Track Initiative for ending AIDS as a public health threat by 2030. The President's aspiration can only be achieved if each one of us play their role, including you, the media. As I said, the media, you have your specific role that you've played largely very well, although sometimes sensationally, but largely very well. And we want to urge you to continue to play this role. We want to request that you disseminate accurate HIV prevention information, you sensitize the public to go for testing, and for those who are already on treatment, to sensitize them to adhere to their treatment. Those are the messages we would want to hear coming from the media houses to the general public. So please focus on dissemination of accurate HIV prevention messages. Focus on channels that can take this message to the young people, adolescent girls and young women, because, as I said, the transmission is up to 4 times in this group more than it is in the young people. As I conclude, Madam Chairperson and all the members present here, I want to call the general public to stand in solidarity with His Excellency the President, who has challenged us to end AIDS as a public health threat by 2030. And how can the public play their role? Let's all endeavor to avoid risky sexual behaviors and protect ourselves and our loved ones. Let's go and take an HIV test so that we are able to know our HIV status. As I said, HIV testing services are available across the country, in all health facilities across the country. Wherever you go, you will access this service. Some of these test kits are actually also accessible in the private pharmacies across the country. But take an HIV test. And if you are negative, please live responsibly to protect yourself and your loved one. In the event that you are HIV positive, we have services that will put you on treatment and you will remain healthy and useful to your family, to yourself, and to this nation. Last but not least, do not discriminate against people living with HIV and AIDS. These people do exist in our communities, in the schools where our children stay most of the time, in our homes. Some of them are our house help, our spouses, and in our workplaces. Let's not discriminate against them. If they are on treatment, they are productive, and living with them does not put you at any risk of acquiring HIV. Together, we shall end AIDS as a public health threat. Thank you very much. Once again, you're most welcome.
Thank you, Dr. Vincent. Up next, we have the UNA's country director, Mr.
Thank you, Vincent, for those remarks. And thank you you to our media partners for always being present when we call them. It's good to see a full house. Chairperson of the Uganda AIDS Commission, Dr. Vincent Bagambe, representing the Director General of Uganda AIDS Commission, the representatives of the young people, the Uganda Students, University Students Association, representatives of civil society. I understand that we should be having a representative of people living with HIV, and I do hope that they will join or they have joined us. The media fraternity, ladies and gentlemen, thank you for joining us today to prepare, as we prepare to commemorate the International AIDS Candlelight Memorial Day on 16th May 2025. While we know that this is an opportunity to honor those people who have lost their lives due to this epidemic that we have been fighting for over 40 years, it is also a time that we can look back, see what it is in the HIV response that we can celebrate the achievements, but also what lessons we have learned and rededicate ourselves to end AIDS as a public health threat by 2030. Over the last 3 decades, Uganda has made remarkable achievements in controlling the HIV epidemic, and I think Dr. Vincent has given us the data. It's very good to see the progress that Uganda has made. HIV prevalence has declined substantially over the years. The number of new infections is reducing, not as fast as we would want it to reduce, but it is on a downward trend. And a lot of the people living with HIV know their status and they are on treatment. That is very good. They are also adhering to treatment, the bulk majority, and ensuring that they live healthy lives and continue to contribute to the development of Uganda. For me, I think one of the biggest celebrations is that the bulk of Ugandans are HIV negative. The majority of our population is HIV negative. We have 1.5 million people living with HIV, meaning that the bulk majority is negative. And the challenge is, how do we keep everyone negative so that we can dedicate resources to ensure that those who are already infected are treated and are on treatment and live healthy lives. Despite the gains that Uganda has made, the fight to AIDS is not over. We can only talk about the gains made, but also remind ourselves what needs to be done to have an AIDS-free Uganda. At the backdrop of the global funding shifts, this year's national theme, which is building a sustainable HIV response if we are to end AIDS as a public health threat by 2030, could not be more timely. The HIV response globally is at crossroads today, and ensuring sustainable to 2030 and beyond is very critical. With governments in the lead, UNAIDS continues to work in close partnership with the Global Fund and the US government through the PEPFAR program to support countries to develop AIDS response sustainability roadmaps, which have concrete measures and tools to monitor progress. These roadmaps are a critical tool for sustainability, and I'm very happy that Uganda has made progress in developing the roadmap. I think very soon we should be seeing it launched, and this is the right way to go. At this point in time, where there is global funding shifts, I think there are 3 messages that I would like to leave with the media today. And one of it is that to truly end AIDS and save lives, the response must be truly domestically owned. And when we say domestically owned, we mean that the bulk of resources for the HIV response must come from domestic resources. because that's the only way we are going to sustain and make progress. We will also not be at risk when there are funding shifts from our partners. So we are very pleased to see that the government has had discussions and is making positive steps to take the direction of making the HIV response in Uganda truly domestically financed. The second message is that the focus going ahead to 2030 and beyond must be on populations who are left behind and who are often at the margins of society. These are the groups that are difficult to find, and they are the groups that we are not able to reach through a heavily health-focused response. So we must continue learning lessons from the HIV response up to now and ensure that we are reaching everyone who's left behind and who's at the margins of society and may not easily get HIV testing or present themselves to the health facility to get drugs because they fear that they might be stigmatized or discriminated against. This is the population that we need to be concerned about for Uganda. And a lot of those, as we know, who are getting newly infected are adolescent girls and young women, are sex workers, and key population communities. The third message is that to date, the HIV response is like a table with 4 legs. When one of the legs shakes, then the table is not steady. One of the legs is the national government, who take leadership and lead the HIV response, develop policies and strategies, and ensure that the response is efficient and effective. We also have civil society, who are a critical partner in the HIV response. We have the private sector, who are another critical leg. And then we have the global solidarity, which is global partners who come in to provide solidarity and provide additional funding and support to governments. If any of these legs shakes, the HIV response shakes. And that's what we have seen since January 20th, following the US government executive order, which caused a lot of panic because one of the legs of the table was shaking. So we must make sure that as we go ahead, we are moving with the table intact. And in this third message, I would like to reinforce the importance of a community-led response. Because as we know now, a lot of the people who are positive, the people living with HIV who are positive are on treatment, are in the community. Infections happen in the community. And who reaches the community? It is civil society who are closer to the community and community-based organizations. So as we think about solutions, domestic solutions, let's not forget the community response, which is very, very critical. And if not supported, will shake the table. Finally, just to our media friends, thank you very much for the coverage that you have been giving since January 20th. Just to encourage you, there's a lot of data, there's a lot of information. Uganda has one of the most robust strategic information systems, able to get information, at a click and know where the problem is. So please counter-check the stories. We are available. The Uganda AIDS Commission is available. People Living with HIV Network is available. UNAIDS is available. Please counter-check the stories and ensure that you're passing factual information. But thank you very much, and I look forward to seeing a lot of you marching with us on 16th of March. I thank you.
Well, up next, we have Paul Achai from Uganda National Students Association.
the Director General of Uganda AIDS Commission, the UNAIDS Country Director present here with us, the Executive Director, Board Chair, Dr. Ruth Senman, Media Fraternity, countrymen and women. My name is Paul Achaye, and I do coordinate programs for the students of this country under the Uganda National Students Association. Ladies and gentlemen, as the world works towards ending AIDS as a public health threat by 2030, young people have a critical role to play in this endeavor. According to the UNAIDS, young people aged 15 to 24 years account for a significant proportion of the new HIV infections, making it essential to engage and empower them in this response. Whereas there has been great strides in the reduction of the number of HIV and AIDS-related deaths, a report from the Uganda AIDS Commission indicates that there has been increase in the new HIV and AIDS infections, especially among the young people. As Dr. clearly mentioned, more than a third of the new HIV infections are the young people. Given the number of the new infections among the young people, I would like to invite young people to interest themselves in the fight against the spread of HIV and AIDS. Please be involved in your communities, in your institutions, in your societies. Get involved in advocating for policy change. Young people should get involved in the processes of taking decisions that affect them. At every point, interest yourselves as a generation in order to support HIV prevention, treatment, and care. As young people, we need to interest ourselves in promoting awareness. We should seek accurate information related to HIV and AIDS from the Uganda AIDS Commission. We should seek services. As Dr. clearly mentioned, there are services all over the country. But most times, as young people, we do not interest ourselves in being present to take these services that are available. HIV testing services are available, but how many of us take our times to know our status? Whereas we can update our status on WhatsApp, let's also know our HIV status, because it is important. Ladies and gentlemen, it's a call to support the peer-to-peer outreach. As a generation, we understand our language. We know that we can speak in languages that we do understand. Our WhatsApp tweet, our WhatsApp message, or a tweet on X can speak volumes to our other colleagues in order that they protect themselves at every instance and seek accurate information as we also endeavor to avail accurate information. Ladies and gentlemen, as a generation, we also think it's our mandate to hold our service providers or the people who are in charge of these services accountable. It is one thing for services to be available in one area, but also if there's a gap in other areas, who is there to speak? As young people, we need to be able to address in the right channels such that these services can be extended to us. I feel as a generation, we have a very clear role to play going forward. For the young people below the age of 18, I will continue telling you, you will never die because you are abstaining from sex. Abstain, focus, study, such that you are able to be an important person for this country and for the whole world. For those perhaps who are close to the age of getting married, so you can enjoy sex, wait until you have the right time with the right partner whose HIV status you clearly know. We will be happy to bless you and share in your moment of joy as you get to be united with your partner. Ladies and gentlemen, when I talk about the peer-to-peer engagements, as we go close to commemorating the International Candlelight Day, as the youth of this country, we have a pre-candlelight event. We shall convene at Makerere University with over 500 student leaders and students across the country. And what are we going to be talking about? We are going to be talking about our involvement in the HIV and AIDS response. To what extent are we contributing towards curbing down the spread of HIV in our communities? To what extent are we contributing towards ending stigma? We feel those living positive are human beings with the same dignity like any of us. It is only fair and right that we treat them the way we would love to be treated. Ladies and gentlemen, we all understand that as a country, we subscribe to certain continental conventions. In line with the Maputo Protocol, we all know that there's a contribution of 15% of finances, which is supposed to go towards human rights. And we talk about health of the people. This is a very important area. We want to ask our stakeholders, our government, to avail resources, enough resources, to the Uganda AIDS Commission to be able to then contribute effectively towards coordinating HIV response in this country. On this note, I would love to thank the Uganda AIDS Commission under the leadership of the Director General for the great work which the Commission is doing, reawakening and involving us as a youth in the fight against HIV. Thank you very, very much, Uganda AIDS Commission, for the great work. To the civil societies, I want to thank all the civil societies. As in audio programming, we see a number of young people getting involved. We feel like we could still do more. Let's amplify more the voices of the young people in HIV response and programming. We want to call upon young people to get empowered to take action. When you don't have accurate information, you have little to say. And when you have little to say, you'll have no space. Let us get empowered. Let's get correct information. Let's understand what we are dealing with in order to meaningfully engage with our stakeholders and other partners. Together, we can empower young people to play a critical role in ending HIV and AIDS as a public health threat by 2030. Let us work together to create a world where every young person can live a healthy, HIV-free life. And for the young people who are living positive, may they be supported. May we care for them, and above all, may we love them. In the spirit of the commemoration of the International Candlelight Day, I call upon young people to light a candle. Light a candle on the 16th, wherever you are, in memory of those who passed on to HIV and AIDS. But most importantly, let this be a moment that you are reawakened, that you remain conscious and sober to the fact that HIV is still with us. And let this be an opportunity for us to know that when we join hands together, we can meaningfully contribute towards the attainment and the achievement of Vision 2030 for God and my country.
Thank you, Paul. Next, we shall have a representative from Nofanu.
Good morning, viewers, my fellow panelists, the chairperson and the director general, the Uganda AIDS Commission, and my fellow people living with HIV watching us. My name is Namiga Deshandra, a young woman born and raised a positive, a graduate as well. I'm glad to be given a chance to be the voice of people living with HIV in Uganda here today. And I would love to talk about the role of people living with HIV play in the national sustainability. As we remember millions we've lost due to HIV/AIDS, we also love to celebrate those that have lived for the art innovation. Today, I would love to talk about the role people living with HIV play in the sustainability of the HIV national response. As individuals directly affected by HIV, they also bring a perspective, experience, and an insight to inform their effective programming and policy making. My experience with HIV response sustainability. I've seen firsthand the impact of funding freeze previously and the recent freeze on our community. Also, as IAPS, I've been part of the communities that continue to support my fellow young people living with HIV to stay on art and adhere, to also participate in research and advocate for the end of stigma and discrimination. We all know there are people out there that can't reach here, that are not given a chance to come out, but they're stigmatized and discriminated in the communities. The recent funding freeze and termination stand alone the TB clinics. We were stopped from marking. Lots of adults and out there and young people living with HIV lacked treatment. Some of them got lost. We now trying to bring them back to the clinic due to the freeze. These have threatened the sustainability of virtual life, saving HIV prevention, care, and treatment support. Our response as people living with HIV, through our mother network, Nafufano, we have mobilized and advocated through the Ministry of Health and the Uganda AIDS Commission, and engage for the increased funding, policy changes, and the HIV response to fill the gap that was created by the freeze. Looking ahead, we all continue to advocate and support each other to push a future where everyone living with HIV can thrive. Our ask from the government, the civil society organization, and the stakeholders. This goes to the government. The government should allocate sufficient funds to sustain the HIV services, most especially for the art part, where these people need treatment. We also, when the freeze came in, people lacked where to get the art from, and they were afraid they're not going to be given services anymore. And this also goes to the government. The government should also develop and implement policies that support people living with HIV. Such policies protect them from being discriminated in the society and also protect them from stigma. Still, the government should engage people living with HIV in decision-making policies, because you can't decide for someone without listening from them. So the government should look into it. To the civil society organization, amplified advocacy. The civil society organization should amplify people living with HIV voices and their concerns. Capacity building. Provide capacity building opportunities to people living with HIV to enhance their skills and knowledge. Support system. The civil society organization should support people living with HIV with counseling, peer support, just as one of the panelists said, these people are supposed to be given support and also look into their referrals. And this goes to the stakeholders. Mobilize resources to support people living with HIV programs and services to their areas of operation. And lastly, as I'm closing, still to the stakeholders, promote stigma reduction efforts, misconceptions and practices that increase HIV infection, most especially in the young people. Thank you so much.
Thank you. Lastly, we shall have the chairperson, Uganda AIDS Commission, Dr. Ruth, before we go into Uganda.
Good morning, everybody. I hope you're fine on this fine morning. Thank you for being here for us. A representative of the Director General, the AIDS Commission, the UNAIDS Country Director, Mr. David, Paul and Shirley. Thank you for being here, representing the young people, and then Namugera, representing people living with HIV. The media present, and ladies and gentlemen. Once again, I just want to say thank you so much for coming. We talk about HIV/AIDS and the fight is still on, 4 decades later. You know very well that Uganda AIDS Commission was established by an act of parliament and takes strategic leadership in harmonizing everything that we do from all the stakeholders within the agri policy and programs to see a population free of HIV and its effects. That's our goal. We want a population that is free of HIV and its effects. So we develop policies and plans and strategies. We are in the middle of developing a strategy for the next 5 years, nationally and also for our own work with the Uganda AIDS Commission. So we want to reduce new HIV infections, increase the proportion of people living with HIV so that they can, not increase their proportion, but the people living with HIV to be able to access services and adhere to care and treatment. Those are some of our goals. So how have we as a country responded to the HIV epidemic? We want to thank HE, the President of Uganda, for the lead and the initiatives he has taken in the HIV and AIDS disease that has enabled us to have a significant and positive impact on what we term as the HIV response. If we look back in history, and many of you, even those who are here, don't have a lot of that history. I remember someone saying maybe we should do something to jog the minds of the people to remember what used to happen before. There was a time when there was no treatment of this, what we call the strange disease. It was considered a mysterious disease, and so people attached it or ascribed it to witchcraft and bad luck. At that time, we knew that anybody who was diagnosed with HIV/AIDS was sure to die. The stigma and discrimination surrounding the disease from close family members and communities was even killing people affected with HIV more than the disease itself. Many hid the patients, many did not provide food and medicines because of the shame surrounding the disease then. There were instances of people living in the same household but would not share cups and plates because of AIDS. even after people had died, their families, the widows, the orphans, faced that same discrimination in the community. So for many years, stigma and discrimination was a great hindrance to the HIV response. The AIDS-related deaths were very, very high because having HIV meant that it was a death sentence. At that time, the prevention campaign was promoted to the ABC approach: abstinence, faithfulness to your sexual partner, and correct and consistent condom use. We admit and thank the media because they contributed greatly to the increasing of the awareness about the disease, demystifying it, disseminating the information through radio, through TV, and they provided coverage through newspapers and also through things like Feed and Tire and another person called Elvis Vascular Vision Group. So looking back as a country, we have made progress. HIV then was 18% among the general population prevalence. Today, we have made great strides in that field of HIV research, science, and have improved our knowledge of the HIV virus. It's a very difficult virus and it has eluded many people, but now we are making a lot of headway. So we now have rapid HIV testing kits. You can test from home. You can go at that very minute, you know your status. We have medicines to prevent exposed HIV negative people from acquiring HIV. So if someone is HIV positive, married to someone who is HIV negative, we have medications and things to help them from not acquiring HIV from their partner. We have medicines that treat those with HIV and suppress the HIV virus to an extent that when you are fully suppressed, you cannot pass on the virus to someone else. Currently, our HIV prevalence stands at 5.1. So you can imagine coming from 18% to 5.1 in the 80s, from 18% in the 80s. So out of the approximately 1,490,000 people living with HIV, we have over 1,300 people who are receiving treatment, just as Dr. Bagambe had said. And we thank the government of Uganda and the partners for getting us to here. I also want to echo what Madame Jacqueline said, that our population right now is about 45 million people. So out of the 45, only 1.5 people are positive, which is wonderful. That larger part, 90-something percent, 98% of the population is not HIV positive, and we need to be able to rejoice about that. So we are receiving treatment through the government and the partners. In 2021, UNAIDS released their 2021-26 strategy in line with the new Sustainable Development Goals. So the new Global AIDS Strategy seeks to reduce the drivers of the AIDS epidemic and get the world on track to end AIDS as a public health threat from 2030. The International Candlelight Memorial Day is why we are here, 2025. This coming month, Uganda will join the rest of the world to commemorate the International Candlelight Memorial Day, a day when we stand in solidarity with those who have lost their loved ones to AIDS. And I'm sure, very sure, that each one of us has someone in their family, immediate or extended, who has been affected by HIV/AIDS. Personally, I lost a brother, I lost his wife and their child to HIV a few years ago. So I know and I'm affected. So it's a great thing to be able to remember them, but also know that we are not just remembering them for the sake of remembering. We want to make it better. We want to have a population free of HIV so that we can say that all the people in Uganda are HIV negative. We want to be able to say that at one point. The theme for that day will be ending AIDS by 2030 building a sustainable HIV response. The celebrations will be held on Friday, 16th May 2025 in Kampala at the Uganda AIDS Commission. On the morning of 16th May 2025, we have organized a walk from the city square, Constitutional Square, to the Uganda AIDS Commission in Tinga. The chief guest is Honorable Bakudebile Babalanda, who is the Minister for Presidency. So I'm inviting all of you to participate in this walk. In addition, we are going to have HIV testing services at the Constitutional Square, in Nakawa, and at Tinda markets. These services are going to be free for all. What is the purpose of this day? As I've said, we are raising awareness on HIV, but we are also asking you to remember. You know, it's very easy to forget. And every now and then we have to jog your memory and remind you of what happened in the past. We want you to take time and think about HIV and AIDS disease. Although Uganda has made significant progress in achieving the goals outlined there, the burden of HIV and AIDS remains unacceptably high. The women and the girls are shouldering a very high HIV burden compared to the male population, even though we find the male population is dying faster than the women because they don't seek services. So with less than 5 years to 2030, we need to focus on the following areas if we are to achieve the goal of ending AIDS as a public health threat. The first one is that we are focusing on adolescent girls and the young women. We've already seen our friend here, Shadra. Thank you so much for boldly standing out. Almost half of infections are among adolescent girls and young women aged between 15 and 24. We therefore need to re-engage our efforts to reach young people, just as Paul has told us. Their peers, their parents, and engage them. How do they want us to set these messages? Sometimes we are looking at the way we send messages as older people, and we don't think of how they receive them as younger people. So we want the involvement of young people to see how we can reach their peers to ensure that the prevention messages are setting in and being heard and being listened to. We find that we have 6 people that are infected with HIV every hour in Uganda. That's very large. We are not supposed to have anyone being infected each hour. So we need to protect this vulnerable population. The second area is to do with stigma and discrimination. This still remains an issue in the national response, and it negatively impacts on HIV testing, it impacts on treatment, and also adherence to treatment. Stigma and discrimination results in refusal to go for HIV testing. Tell someone, let's have a test, and they say, no. How are they going to see me taking a test of HIV? They will think I've been misbehaving. It also leads to living in denial after the HIV test positive result. And it can also, this discrimination and stigma can lead to non-adherence to treatment. Sometimes you start the treatment and then someone says something and you say, I'll never go back to the clinic again. I am not taking medicine again because of that. So our request is that HIV, stigma, and discrimination is addressed at individual levels, at family levels, at community levels, and country levels in order to create a stigma-free environment for people living with HIV. People should be able to walk into clinics without being pointed out as different or doing something that they shouldn't do. The third area is the HIV response funding. As you have heard from the previous speakers, our response, HIV response, is heavily donor funded, especially in terms of funding for HIV medicines, condoms, and testing kits. It costs the government approximately $700,000 per person each year to treat that person who is living with HIV. So if someone is born with HIV, for the rest of their lives, the government is going to be treating them, and that's a very expensive venture. And because of shifting priorities of the donors over the years, and also recently when the President of the United States issued executive orders freezing US foreign aid for 90 days, there has been a marked reduction in funding, which undoubtedly impacts on how much we can do in terms of HIV prevention interventions, in terms of testing and other related activities. And as you have heard Chandra say, definitely this has affected our people. Although at times, because of the media and the way they are saying things, sometimes it makes it look like there is no medicine at all. So as a country, we are here, as a government, we are trying to reassure you that we are doing everything possible to ensure that everybody who is on treatment continues to have the treatment uninterrupted. As a country, we are also developing what we call the sustainability roadmap that has been referred to by Dr. Magambe, which when complete will ensure that we take actions to enable us fund the majority of our HIV response. What Madame Jacqueline called domestic funding, that everything that we do in our country is being funded by ourselves, so that we are not shocked into running off or fainting or dying when donor funds stop coming in. The number 4 area that I want to emphasize is that there is continuity of HIV treatment services irrespective of what has happened. We are assuring you as a government, as Uganda AIDS Commission, that there is continuity of free HIV treatment services, even though there has been reduced financing of the HIV response. Government has advised persons living with HIV to continue accessing HIV services. As part of the reforms to enhance the service delivery, HIV and AIDS services have thereby been integrated with other services like TB, hepatitis B, hypertension, and diabetes. They have been integrated into routine and chronic care services across all healthcare services in the country. This will also help to minimize the duplication and enhance efficiency and effectiveness. We would like to assure Ugandans on the continuity of free access to the antiretroviral treatment. So don't let anybody tell you that we are running out of stock. Don't let anybody sell medications to you in view of the fact that there are no medications in the hospitals. The medications are there, and so stand up for yourselves and get that medication free of charge. We have enough stock of ARVs required to treat people living with HIV without any disruptions. So persons living with HIV are advised to continue accessing their services as before. The 5th area, I want to briefly talk about the impact of the media and communication strategies. The media is a very, very strategic partner in the fight against HIV and AIDS. They are strategically placed, they are very powerful in disseminating HIV messages countrywide and globally. I think you know that yourselves. You can either bring someone down or pull them up. So we want to take that powerful and strategically placed group of media people who are with me here today and urge you to continue covering us in the issues of HIV and AIDS, in the areas of stigma and discrimination, in the areas of sustainability of the HIV response, so that we can achieve our goal of ending AIDS as a public health threat by 2030. I would like to thank the President of Uganda, His Excellency Yoweri Kaguta Museveni, for the exemplary leadership in the fight against HIV and AIDS in Uganda. Without strategic leadership, we cannot fight HIV/AIDS. I I want to thank our 8 development partners and the government of Uganda who have ensured that the people living with HIV/AIDS have access to services. Thank you very much. I want to thank the religious and cultural leaders for spearheading the fight against HIV/AIDS, especially around stigma and discrimination of people living with HIV/AIDS. Culture and religion has really helped us in that area. We urge you to continue addressing the myths and the misconceptions of HIV and AIDS in the community. I would like to thank the people living with HIV networks for their role in representing people with HIV and their awareness campaigns, and that they have faithfully done. They keep on encouraging us to use the right language, to speak, to say the right things. I want to thank Uganda AIDS Commission for coordinating the HIV multi-sectoral response for the past 30 years with evident results and progress. Thank you very much. As I end, I want to call all of us to action. We need to end AIDS as a public health threat, and it begins with each one of us right here. 1, get to know your HIV status today. Today, if you don't know it already. And if you are found with the virus positive, start treatment immediately. I can hear someone already saying, oh. Start treatment immediately. If you are already on treatment, take your medicines faithfully, on time, and daily as prescribed. Don't let anything pull you behind, whether it is the freeze, whether it's US, that the government done what, whether it's the election, nothing should pull you back from your medication. If you are pregnant, ensure that your unborn baby and eventually your newborn baby is protected from the virus. Go to the health center and make sure that you are provided with everything needed to protect that baby. If you test, just like Dr. Bagambe said, and they find that you have no virus, please don't rejoice and go celebrating to get the virus. Instead, ensure that you do your best not to get it. Lastly, I just want to encourage you to join us on Friday, 16th May 2025 at the City Square as we work to build a sustainable HIV response to ensure that we end AIDS as a public health threat by 2030. Thank you very much for God and my country as we end AIDS by 2030.
Thank you so much, Dr. We request Dr. Vincent Bagambe to give us a brief summary regarding this response.
Chairperson waffe omwagalwa owa board ya Uganda AIDS Commission, omukungu wa UNAIDS mu Uganda, representative wa Nafofano, executive director, coordinator w'ebitongole ebya abavubuka mu Uganda, Paul, abanamawulire abali wano mwena y'omu mu kiti kye, mwebale kujja. Nze Vincent Bagambe ndi wano kubanga mukama wange tasobodde kujja, Director General Uganda AIDS Commission, naye ndi musanyufu nti nsobodde kumurepresentinga. Olwaleero twagala kutegeeza Abannayuganda mwena nti tugenda kukuza olunaku lw'okukoleeza emisibaawo, Candlelight Memorial Day, nga ennaku z'omwezi 16 omwezi guno gujja ogwa May 2025. Omukolo guno genda okubeera ku offices zaffe za Uganda AIDS Commission Entinda, naye nga tujja kutambula, tujja kutandikira ku Constitutional Square wano mu kibuga e Kampala, tutambule ne police ne bandi namwe abantu aba bulijjo mpaka okuva ku Constitutional Square mpaka nga tutuuse Entinda. Tuyise Jinja Road, Enakawa, tubala tu estimating anti kuliko kilomita nga 10 ndowooza tusobola ozitambula. Kaakati ekigendererwa kyaffe kwe kulaba nti Uganda ng'eggwanga twegatta wamu n'amawanga amalala ag'ensi yonna okujjukira abo abaafa ku bw'obulwadde bwa mukenenya, ate kwegatta wamu ne families ezo zonna ezaafiirwa abantu baabwe. Naye n'ekirala tujja kukozesa omukisa guno okujjukiza Bannayuganda naddala nnyo abaana abato abavubuka, abavumbuka mwe mbalaba wano, nti akawuka ka mukenenya kakyaliwo. Uganda ng'eggwanga tukoze omulimu gw'amaanyi nnyo okuva mu mwaka gwa 1909 mpaka kati. Kati bwe ogerageranya obungi bw'obulwadde obwaliwo mu biseera ebyo 1909, 2000, 2010, obulwadde bugenze bukendeera. Kati okupima obulwadde oba bukendeera oba bweyongera tukozesa ebipimo nga 3. Ekisooka, bantu bameka abafuna akawuka ka mukenenya buli mwaka, kye tuyita new HIV infections. Kati tugenda tulaba ekyo kikendeera. Mu mwaka 2010 twali tufuna abantu 10,000 buli mwaka. Jjukira obwe population ya Uganda yali ekyali ntono, naye kati ekyo kikendeera. Kati mu mwaka oguwedde tu estimatinga tuteebereza nti abantu 3,800 tulwanye nnyo ezo tetunatuuka we twandibadde twagala okwesanga. Gakyali mabaga kubanga twalibadde twagala nti tewali n'omu afa ku akawuka ka mukenenya. Twalibadde twagala nti abaana abapya atanafuna akawuka ka mukenenya takafuna. N'olwekyo kasita tuba tulaba nti abantu bakyafuna akawuka ka mukenenya oba bafa, kiba kitegeeza tulina bindi bye tukyalina okukola. Ekyokubiri, mu mawulire kibaddemu nnyo, ndowooza buli omu akimanyi nti okulwanyisa akawuka ka mukenenya tubadde tukozesa nnyo essente eziva ebweru y'eggwanga. Naddala nnyo gavumenti ya America ebadde esinze okutuyamba, naye kasooka president omupya agenda ku bukulembeze, gavumenti ya America basazeewo nti baagala kusooka okwekebera, okwechekinga okulaba basobola batya okukendeeza ku ssente ze basaasaanya mu bintu byonna bye bakola, ng'ogaseemu n'okulwanyisa endwadde mu mawanga agakyali manafu agatanabo okubeera developed ekyetaagisa. Kati omulimu otwalidde Uganda. N'olwekyo announcements zaabaawo era abantu ne bafunamu okutya ate abatya si abo abalwadde ba Mukenenya bokka, mulimu naffe abawa services, mulimu naamwe ab'amawulire mwakiripootingako nnyo, naye njagala kukakasa bannayuganda mwena nti gavumenti yamaze okwekebeja neraba nti services zetwali tuwa abannayuganda nga America tenabo okutubuulira bwetyo, services ezo zikyaliwo era zikyagenda mu maaso. Twagala okugamba abannayuganda mwena nti gavumenti yacekinze nesanga tulina eddagala erimala ate newa ekirango mu madwaliro gonna mu ggwanga nti buli muntu anaaba agenzeyo ng'ayagala bujanjabi bwa Mukenenya oba yali mu ddwaliro eryo oba ava mu ddwaliro kati eritakyakola bamuwa obujanjabi. N'olwekyo obuweereza bw'okulwanyisa akawuka ka Mukenenya bwe buli bukyatambula n'amaanyi, buli ddwaliro lyonna mu ggwanga, ate n'eddagala tulirina, ate n'abasawo beetegefu okubajanjaba. Twagala kusiima nnyo minisitule ey'ebyobulamu yasindika ekirango mu madwaliro gonna ng'egamba ba directors b'amadwaliro nti mulina okujanjaba buli omu anaaba batuukiridde, era bakikolamu bulungi. Tumonitaringa ffe n'ebitongole ebikulembera abafuna obujanjabi buno okulaba nti ekinaaba nga tekitambudde bulungi tukibuulira aba minisitule ey'obwobulamu ne bakyusamu okulaba nti abantu baffe bafuna obujanjabi nga bwe kyetaagisa. N'olwekyo gavumenti yo omulimu gwayo okulaba nti obuweereza ebutuusa buli wamu ekyagukola. Ate ekisigadde kyekyaffe ffenna okulaba nti buli omu akola omulimu gwe, nti mwe ngabo ab'amawulire musaasaanya enjiri oba messages okulaba naddala nnyo abaana abato beewala akawuka ka Mukenenya, okulaba nti buli omu atamanyi status ye agenda mu ddwaliro ne tumukebera. Bw'aba nga talina kawuka ka Mukenenya n'asobola okwegendereza, kubanga tolina kawuka ka Mukenenya kati tekirina makulu nti atoddeyo otandike kucelebrating ate enkyokomyewo ng'okalina. Wabula okukebera kiba kitegeeza nti omanye status yo osobole okwekuuma obulungi ate n'okukuuma abantu bo b'oyagala oba bakwagala, osobole okubeezaawo famire yo n'okubeezaawo eggwanga, ikonomi ya Uganda ekwetaaga. Naabo singa bakukebera ne basanga olina akawuka ka Mukenenya, nga bwe ngambye eddagala weeriri tujja kukuteeka ku ddagala, ate tukusaba bwe tuteeka ku ddagala olimire ng'abasawo bwe bakulagidde, osobole okwebeezaawo ate kusigala omu bulamu obulungi n'amaanyi agakusobozesa okukola emirimu gyo. Ekisembayo nga chairperson wange nga bw'agambye, ffe nga Uganda AIDS Commission tukubiriza abantu mwena mujje mutwegatteko nga 16 Ogwokutaano nga bwe tukuma omusabaawo, lighting the candle, nga bwe tujjukira abantu baffe betwali twagala oba abaali abooluganda abaasakambinga oba abaafa lw'akawuka ka Mukenenya. Naye naddala nnyo nti message ensingayo obukulu ya prevention. Muleke mbasaba ffenna twewale emize or practices, behaviors esobola okuteeka mu kabi ak'okufuna akawuka ka mukenenya. Mwebale nnyo, mwebalire ddala, tujja kutambula wamu nga 16 ate n'ekirala mpozi kyenyongerako nti tujja kuba tuwa obuweereza obujanjabi n'okukebera akawuka ka mukenenya free of charge nga tewali kusasula ennaku z'omwezi okuva 14 mpaka 16 nga kampusi ezo tujja kubeera emu ejja kubeera Entinda market endala Nakawa market ate n'eyokusatu ejja kubeera Constitution Square. So njagala mujje mu bungi mukebeze ate mufune n'obujanjabi obulala bwe tunaaba nga tubaweereza. Tubawe ne information mwewala mutya akawuka ka mukenenya. Mwebale nnyo, mwebalire ddala.
Thank you so much, Dr. Vincent. Now we are going into questions. Doctor, we are requesting for a brief summary in Uganda. Your statement.
Had outlined everything. Naye twagala okwebaza nnyo n'okubeerawo olwaleero era nga tubasaba tulina omukolo omukulu ennyo ogujja mu maaso awo nga 16 Meeyi mwaka guno ogwa 2025 tugenda kujjukira bannaffe abaafa emyaka gino gyonna gye tubadde emyaka 40 abantu bangi abafudde obulwadde buno bwa siriimu tuba siriimu oba HIV/AIDS. Olwekyo twagala tubajjukire nga tulina ebisabaawo bye tugenda okuba nga tulina nga buli bwe tujjukira tulina omusubbaawo bwe tuteekawo okubajjukira. Naye ate era n'olunaku luno twagala okutukozesa okwogera ku bulwadde buno kubanga bukyaliwo ate nga bungi ddala tebunatuuka we twagala bukome. N'olwekyo tujja kubeera nga twogera kiki ekibuleeta, tuweewala tutya, bwe tuba tuwulira tukoze tutya, ebyo byonna bijja kubaawo. Era tujja kuba ne services ezimu eziyamba okumanya obulwadde obwo oba obulina oba tobulina, era n'okuba nti endwadde ezimu tuzoogerako. Ate tulina emyaka 5 gyokka gye twewadde nga twagala okuba nti omwaka ogwa 2023 omwaka ogwo twagala tube nga bingi nnyo bikendedde nnyo oba bikenderedde ddala nga okufa kw'abantu ab'obulwadde buno otujjukira nga abafa obulwadde buno nga bakendedde nnyo oba nga tebakyaliyo, nga bakaddiwa ne bafa bukadde nga tebafa siriimu. Twagala okuba nti abantu abaleeta obulwadde nga nabo tebakyaliyo, nga n'ababulina tebakyasobola kuwa balala kubanga bali ku ddagala bulungi bakola nga bwe balina okukola. Tulowoozezza nnyo ku mwana omuwala ow'emyaka 12, 15, myaka 2 abali ku kampasi, abali mu P7, abali mu S3. Ekiseera ekyo kizibu nnyo mu baana, ate abawala bafunye nnyo obulwadde buno. Twagala nabyo tuyogereko nnyo abaana bano baleme kutufaako nga tulaba tube nga tulina kye tulina okukola. Twogedde ku kye tuyita stigma. Okusosola kuleese nnyo obuzibu. Jjukira emabega eyo mu myaka gy'ekinaana ng'abantu abalina obulwadde buno tebajja na mu bantu, tebalya na bantu, babasibira mu nnyumba. Naye eyo tuvuddeyo era twagala tuviireyo ddala tube nga okusosola nakwo kukendeeredde ddala. Ekyokusatu kye twogeddeko, ssente ezirabirira obulwadde buno oba ezikendeeza kye tuyita HIV response zigenze zikendeera, ate omukulembeze wa Amerika bwe yajja naye n'akyongerayo. Olwekyo tulina okunoonya ssente mu Uganda muno zetusobola okukozesa okulaba nti nno obulwadde buno bumalawo ate nga tebweyongera bweyongeza, era tukoze nnyo okulaba nti ekyo nakyo kigenda mu maaso. Era twagala okubazzaamu amaanyi tubagamba nti obulwadde buno eddagala gyeriri, tuliyingiza mu malwaliro gonna, likyaweebwa nga bwe libadde liweebwa era terigenda kuggwaawo. So tebabalimba n'akamu, eddagala liweddeyo, tebaffe abalitunda tuli wano naye eddagala gyeriri. Era kati tusaba aba media tuyamba n'amawulire banti boogerera ddala ebituufu, boogera ku bulwadde buno, bakiraalaasa, bakyongerayo ddala okulaba nti nno obulwadde buno tubwogerako abantu ne babutegeera. Twebaza abantu bangi nnyo abatukoledde ebintu ebirungi kumanya nti obulwadde buno buweddewo. Era tubasaba ku lunaku olwo twegatteko, tutambule okuva Constitutional Square ku City Square tutuuke ku Ntinda ku offices zaffe, naye mutegeereyo manye nti ebyo tukolere emirimu gyaffe. Tuuke twogere, omukulembeze waffe Honorable Mire Babalanda yagenda chief guest w'olunaku olwo, tubasaba okuba nti mukuje. Mwebale nnyo, mwebale ddala.
Thank you, Dr. Ruth. Now we're going to go into questions. Please state who questions direct.
Nsaba kubeebaza aboogezi baffe olwaleero. Dr. Ruth, waliwo ekintu ekiri mu public ekitrending ekyokwekebeza. Abamu ba prisoners, abamu abagenderawo ku oli n'agamba ngemba ngenda okukola ekikolwa twekebera ssaawa eyo ne tugenderawo. Yes, ne okugendera mu kikolwa eky'abantu abakulu. Kati n'abamu bagamba kits eziri mu public ezimu nfu. So ekintu ekyo tusaba mu kitangaazeemu. Kits ki eziteekeddwa okwekebeza? Era omuntu okwekebeza nga si musawo olowooza kigwanidde mu public yaffe? Tusaba tukiddamuko mu Uganda ne mu Luzungu.
My name is Grace in Box of Media. Waliwo ebintu bibiri byenjagala okusakisira. Esookera ddala gavumenti yali ziriteekateeka y'okuguza bajeti ya kulwanyisa Mukenenya Ministry of Health buli mwaka. Naye tulaba nti waliwo setback ey'okuba nti ssente zisalibwako okuva mu mawanga amagali g'obuyambi. Kino kikyagenda mu maaso. Ekyokubiri, misconception. There was a government arrangement whereby each year on an annual basis it was meant to increase budget to combat HIV. Ministry stressed it recently. Is this program still on? If it's not on, how has it affected your activities and what are you intending to do? Second, there was another project called the AIDS Trust Fund. This fund was intended to assist you in some of your activities. All along, it has appeared in Parliamentary Health Committee, you demanding the increase of this money. So far, how far we go?
My name is Sandra Mvenye from MEDIA Television. All of you, in what you've said we don't have any current stockouts, but I want to bring this to your attention. I do not know whether you know about it. At DRC Entebbe, in some western parts of the country, but also in Tororo and Busia, some of the regiments are out of stock, and these are drugs for young people. When you look at regiments like Instress, I do not know whether that is the right pronunciation. It is out of stock, and this is arrangement for many young people. I do not know whether we're just giving public statements or Those are the facts on ground. Have you heard about these stockouts as you people at the commission? Thank you.
Good morning. I am Dorothy from NTV. My question goes to Dr. Bisi. Given the U.S. executive order that impacted HIV funding in Uganda, what is the current status of the Uganda AIDS Commission budget allocation for the upcoming financial year? And also, what are the strategies being implemented to ensure sustainable funding for HIV initiatives in Uganda, just to cover up the 55% we talked about we used to get from US. Thank you. My question goes to Dr. Ethan. Particularly, I want it in Uganda. Region, I want to go for new infection. Then why? Also wanted the gender, but you mentioned the gender earlier. Thank you.
Thank you very much, Andres. The fact that you say even when USA declare that they are no longer funding the government of Uganda in regards to the fight against HIV, but still, my question is, can't we do away without the funding of US? Because I believe this government has got money. They have money, and there's no any setback when you look at your statements. And in my opinion, I also think if you over rely on those countries, I don't see any sustainability in the fight against HIV in this country. Dr. Dorothy, my question comes to you. I'm Mashim Sambus. I work with Point FM Radio Mubende. Nainja kibuuza mu Luganda. Tuwayisa Mukenenya tutunuulidde nnyo abantu bangi abavubuka naye otambula ebitundu by'eggwanga bingi osanga nga bannyinaffe bangi beeyongedde ku nguudo abakozesa emibiri gyabwe okufuna ekyokulya. Mu kulwanyisa Mukenenya bannyinaffe bano mulabika nga be mulesse emabega ate ng'oba oli awo olutalo lwe tulwana okulaba nga 2-3 Mukenenya aba aweddewo baali badde basaale kubanga be bamu batunuuliddwa okuba nga baviirako obulwadde bukwongera okusaasaana.
Mwebale nnyo okubuuza ebibuuzo ebyo. Ndowooza kansooke n'ekisembyeyo bannaffe abali ku nguudo be tuyita aba sex workers lwaki tubaleseeyo emabega, era ndowooza mwawulidde bulungi mukyala Jacqueline ng'ayogera ku ba sex workers n'abo abasinga okutambuza obulwadde. Mu Uganda mulimu abantu batono bwe bati naye nga batambuza obulwadde lwa nsonga tebali ku ddagala ate ng'emirimu gye bakola gyeyongera kutambuza obulwadde buno. N'olwekyo ffe nga eggwanga, ffe nga Uganda AIDS Commission tubaliko nnyo tetunabeerabira era tetubasuula eri. Waliwo abantu abamu abatasobola kukolagana nabo nga religious leaders, kizibu nnyo okukwatagana ne sex worker kubanga tebatambulira mu kkubo lyabwe, naye tetubalese mabega era tufuba okulaba nti amaloboozi gaabwe tugateeka ku mmeeza ne babayamba ne boogera nabo ne bafuna obuyambi, bafuna testing, ne bafuna engeri gy'okukolamu emirimu gyabwe ne baba nga banaayongerayo emirimu egyo. Tetubalese mabega, bwe tuba nga tubalese mabega era tufuba okulaba tubaleeta tetubeerabidde. Ebintu ebintu ebisinga ebirala ngenda kusaba Dr. Bagambe okubiddamu.
Thank you very much, Madam Chairperson. Maybe I will ask her to say a little bit about testing for HIV before sex, and then I will take on after her to answer all the other questions.
Hello once again. I'll answer a question just because I'm not going to know your name. Serena. She asked about testing before going into the act. Is it really accurate? And she also talked about the self-testing kits. Did they give accurate results? We have different self-testing kits. If oral doesn't work for you, there is the oral quick and sure check. Sure check is the one used for blood. There are those people that already say, I would not love to use the oral quick. I don't know whether it will give the accurate results. So we would advise you to opt for sure check. That is for blood, because most people get convenient using blood, checking using blood. And this part of testing before going for the act, and after testing you immediately go for the act. I wouldn't advise for it, but then it's at least better for someone to test than this one that hasn't tested, then going for the act. So it's better you just and then you present the results you got. If you're not sure about the results, you can come at any health center or hospital around, then you go for the accurate results you want.
Thank you so much. So maybe to add a little bit more on that, do you remember what we used for, and it still is actually a fact? A window period. Do you remember window period? When a person newly acquires HIV, they don't seroconvert immediately. There is a window period. Some people take maybe up to 3 months. And some people take longer, sorry, 3 weeks up to 3 months. Some people take up to 3 weeks, and some people can take even as long as 3 months. And the window period is the period between when the HIV virus has entered your body and the time when the body has produced antibodies, so that when we test your blood, we are able to detect that you have HIV. So people who do an HIV test and then continue to have sex, it's not good. If you find somebody in the window period, unfortunately, the person will be transmitting. They may not have antibodies, but the virus is there and they can transmit it. So the advisable thing is that in fact, if you remember, we'll do a test and then we ask you to test after 3 months. And then that's when we'll be sure that you either are HIV, that you are HIV negative. And you can wait. Honestly, why the hurry? Why the hurry? Why, if really you have a genuine love for this person and you want to have a serious relationship, 3 months is not that long. Yeah, if you want Kabira, you know that's risky sex. That's risky sex on the area. I think about self-testing and testing outside the health facility setting. You can test, and if you are positive, we would recommend that you come to the hospital. We will do another test and indeed confirm. Most of these tests are good at identifying the negatives, but sometimes they miss the positives. So it is always important that if you test positive, you come to the facility and we test you again, and then we can put you on treatment. I hope that I am clear on that. Now, secondly, about the government of Uganda annual budget increase, and if it has helped in the setback that we've received from the reduced funding from external sources. So these are two facts. One fact is that indeed, government of Uganda has been making an annual increment in funding for HIV services, especially towards procurement of antiretroviral drugs. Indeed, now, where we stand, government is buying 35% of the drugs for HIV, the antiretroviral drugs, are procured using government funds, which means that about 60 to 65% then is procured using by our partners, PEPFAR, but largely the Global Fund. And so that's a fact that government's funding has been increasing. Unfortunately, it's not increasing fast enough. And that's why when the donor support drastically reduced, we were all concerned. It will take time at this increment for government to be able to fully take up the funding for the entire response. So if your question is government's funding still there? Yes, it is there and it is increasing. Whether it helped in offsetting the setback we got, yes again, because as I said, we had enough stocks of drugs. Imagine if the announcement came and we didn't have drugs in the store, and perhaps we were waiting for these drugs to come from outside, what would have happened? So yes, it has helped, but we want to encourage that the government increases more on the funding for not only drugs, but also other HIV services, so that eventually we can be able to manage this problem largely internally. And partners also come to support the other areas. About the AIDS Trust Fund, ladies and gentlemen, at one point, yes, an act was passed by Parliament that a special fund be created from some taxes to manage the HIV response. But after some time, as you know, the legal landscape keeps evolving. There was another law that was passed that government should stop creating different special bags of funds. And that is how then Minister of Finance, working together with the Minister of Health and the partners, agreed that, okay, if there is no AIDS Trust Fund, or if we are not going to implement AIDS Trust Fund, let's get assurance that that Minister of Finance will be increasing annually a contribution towards the HIV response, which has been implemented ever since. There was somebody who got concerned or who said that actually we are here saying that there are no stockouts, but they are receiving reports that there are stockouts. What I can say about this is that yes, we receive these reports too, and we work with Minister of Health to go through the districts. The Minister of Health, as you know, has a district health officer in each of the districts. So working through those structures, we got verified. And in many cases, we have found the initial one, by the way, there was, should I call it a shock? So what they were reporting as stockout was not actual stockout. Sometimes the health workers didn't know whether they should give out the drugs or not. So with that clarification, yes, we continue to receive reports, a stockout here or there, and when we go to verify, we find either there was a delay in delivery from the regional store to the facility, And we can do mobilization within the district so that these facilities continuously get the medicines that they require to provide the service. Okay, so thank you, Chair. My chairperson has also brought the other aspect that some people who were receiving medication for 6 months, as you may recall, we had reached a point where if a patient was stable and didn't need to come to the health facility as frequently, we could give them medication for 6 months and they are at home and they don't need to come back unless they are observing something abnormal about them. So in this reorganization, some of these people come and instead of taking their 6 months allocation, we reduce it so that at that point, we are still trying to be sure to take stock and know how we stand. But I can assure you that at the central stores, the national medical stores for government and joint medical stores for the non-government health facilities, we have enough stocks of these medicines, and we will continue to address the challenges of distribution to make sure that all the health facilities have sufficient stock to provide the medication. In the event that you receive those reports, please don't hesitate to reach out to us so that we are able to respond real time and be able to ensure that the redistribution is effective. Somebody asked if the executive orders affected the Uganda AIDS Commission budget. Uganda AIDS Commission is a government organization. We draw our funding from the Treasury. So the executive orders did not affect us directly. However, we were affected due to the fact that it caused commotion and everybody was calling us. We had to have a chain of meetings. We had to engage and advocate to ensure that people continue receiving services. And in terms of the strategies, we are putting in place to ensure that HIV services are sustainable beyond the donor support. One of them, as I said, is integration, which the Ministry of Health has already started implementing. That instead of having the standalone HIV clinics, which require standalone health workers, some of them specialized, some of them, by the way, within the premises of the health facilities, excuse me, we have integrated services where one health worker can see you when you come for HIV services, you come for your pressure or diabetes, you come for maybe cancer review or screening, and you come for any other medical condition. It could be malaria, it could be fatigue, it could be backache or any. Instead of you, the patient, visiting several times, you make one visit, you are seen by one health worker. So it becomes cheaper for the recipient of the service, but it becomes cheaper for government and the other service providers. The other aspect that we are looking at is to make sure that some of the services that we are being offered by our friends, the development partners, are integrated into government programs, so that priority is given to vulnerable people to reduce vulnerabilities, including services like parish development model. If it is well targeted and well streamlined, it will fight economic vulnerabilities. If people are economically empowered, then it gives them power to negotiate for safer sex. But also importantly, all these programs interface with people. So we can go through these programs And we are planning that we'll be going through these programs to deliver HIV prevention messages to the people. Rather than having standalone programs that cost a lot of money. So that also can save on the costs. We have community structures. We have the religious institutions, we have cultural institutions, and we are engaging with these institutions to equip them with information so that as they engage their subjects or their congregants, they use the same platform to disseminate HIV prevention messages. And I want to call upon you, the media, as the chair has already said, you are a powerful voice and you have our ears, especially the ears of the young people. So we believe that the information we are sharing with you here, you can disseminate it and it reaches the people at no extra cost. So those are the cost-cutting approaches and measures and many others that we are coming up with to ensure that even without funding, we'll be able to continue delivering messages and delivering services to our people. But certainly, we will need to have additional funding from government, even as we reduce the cost of delivering these services. Which regions are most affected? Ma regions ki oba bitundu ki by'eggwanga ebikyasinze kufuna okubeera n'akawuka ka mukenenya. Nja kukyogera bwe nti si bwogerageranya ebitundu bya Uganda nga Karamoja, West Nile ne Bugisu region bebalina akawuka ka mukenenya kakyali wansi bwe tuba tutunulira ku prevalence. Naye ebitundu bya Central Uganda ne Southwestern Uganda wamu ne Central North, the Acholi region, Kitugumuguru, and to a less extent, Rangi, prevalence eri waggulu nnyo okusinga ebitundu ebirala. Kaakati n'ekirala ojja kusanga nti twogedde nti Buganda region eri mu Central Uganda akawuka ka mukenenya kali waggulu, naye ate era bw'ogaziwa n'otunula n'oweeyongera kutunula ojja kwesanga nti awali ekibuga akawuka ka mukenenya kali waggulu okusinga mu byalo. Waliwo n'emirimu emirala egiteeka abantu abagikola ku risk y'okufuna akawuka ka mukenenya. Katugambe Karamoja, Sese Islands wabeerayo abavubi bangi, ate bwe tuba tupima akawuka ka mukenenya tusanga nti ate akawuka ka mukenenya kali waggulu eyo okusinga mu bitundu ebirala eby'eggwanga. N'olwekyo urban poor, abaana abato abajja mu matawuni ne babeera mu slums, n'ekyo ojja kwesanga bw'opimye eyo ate akawuka ka mukenenya kabeera waggulu nnyo okusinga mu byalo ate mwe baava. Simanyi oba nkikunyonyodde bulungi, naye eyo summary gyensobola okukuwa. Nja kusaba Joanita baweereze ku fact sheets obulaga districts ki ezikyalina akawuka ezikyasinga okubeera n'akawuka ka waggulu ate bibuga ki ebiri wansi oba olyawo nabyo biri. I think I answered this question, whether we can do away with government, with the funding, the donor funding or not. The reality is that the government is doing its best. Naye ebyetaavu byayo nabyo bingi nnyo. N'olwekyo okulowooza nti katuwe tuli services ze tubadde tufuna ziyinza okusigala nga bwe ziri ate zonna ziweebwe gavumenti, ekyo tekijja kusoboka. Wabula tugenda mu maaso nga twogera na mikwano gyaffe naye nga bwe tunoonyamu gavumenti byerina okukola critical services gavumenti zerina okuteekako essira zikolebwe ebirala bwe tuba tetufunye obuyambi waakiri tuweereza abantu obujjanjabi ate tukozese ways endala oba amakubo amalala getusobola okutambuzamu messages zaffe okutuuka ku bantu. I think a female sex workers chairperson akyogeddeko. Mwebale nnyo, mwebalire ddala.
Thank you so much, Dr. Vincent. Now we're going to light our candles. I will request the team to just stand here.
Yes.
Those candles, you can join in. Abalabadde mabega.
So who is commanding us to light?
Go ahead and do so.
Okay,
You can move it.
Let's light.
Wait.
Media center should do the light.
Banang. I need to be also.
Yes. Okay, that's it.
They are collecting your candles.
Yes, colleagues, be informed that Uganda AIDS Commission is also giving us some material so that we can combat condoms. So the condoms are available. Please don't go. Follow. Get. Wezi.